Hello, everyone, and welcome to Let's Talk Tuesday. My name is Tim Mackin. I'm the Chief Communications Officer for Gift of Life Michigan. We are the state's organ and tissue donation program. And Let's Talk Tuesday, of course, is a series of conversations we've been having all year, really, to just delve into some organ and tissue donation issues and other issues as well. And today I'm very honored to be joined by Dr. Silas Norman. He is Professor of Medicine and Director of Transplant Ambulatory Care Unit at Michigan Medicine. And we may also be joined by Denise Brooks Williams, Senior Vice President at Henry Ford Health System. She's having some, she might just be joining us right now. We'll see. I'll introduce Denise when she gets on camera. But anyway, we are going to be talking today with Dr. Norman and in a minute with Denise about National Minority Donor Awareness Month. And looks like Denise is in the house.
I'm almost there.
Almost there. Okay. Denise, I just introduced Dr. Norman, and Denise is the Senior Vice President and CEO North Market for Henry Ford Health System. Additionally, Denise is a member of Gift of Life Michigan's governing board, and I forgot to mention that Dr. Norman is a board member of the Detroit MOTEP Foundation. MOTEP, of course, being the Minority Organ Tissue Transplant Education Program. And very happy to have both of you here. And we are in August, and August is National Minority Donor Awareness Month. There was a time when it was just a day, then it became a week. This year it is an entire month, and it is being coordinated by groups across the nation. We've got UNOS, that's the United Network for Organ Sharing, Donate Life America, National MOTEP, AMAT, that's the Association for Multicultural Affairs and Transplantation, National Kidney Foundation, and I may have missed someone, but basically this is all kinds of organizations across the country coming together to promote organ and tissue donation, especially among multicultural communities. So, Dr. Norman, I'm going to start with you. You are part of Gift of Life Michigan's Let's Talk campaign. You've also served on the UNO Minority Affairs Committee. Can you tell us why you think National Minority Donor Awareness Month is so important, especially during this time?
Absolutely. So thank you for having me. I appreciate the opportunity to be on and talk with you for a little bit. So I think it's terrific to see National Minority Organ Donor Awareness expand to a month. I think it's something important that we talk about all the time. I think in caring for people, we recognize that there's a disproportionate amount of kidney disease in the multicultural community. And in trying to meet that need, there's a clear need for us to expand our messages of prevention of disease first and foremost. And then as people reach end organ disease, we need to understand what we can do to help people in need of tissue and organ donation. And we know that there's a relative deficit in the minority community related to the disproportionate number of people affected. And so any opportunity I think we can to close that gap between the need for tissue and organs and the supply is a great opportunity.
Mm-hmm. Denise, any thoughts you have on National Minority Donor Awareness Month and just why it's so critical?
I would definitely echo what Dr. Norman said. I think definitely the idea that there's disproportionality in the minority community and taking something that historically was a day and turning it into a month, and hopefully helping people to understand how they can be a part of supporting what the issues are that people face that are either looking for transplantation or more hopefully prevention. So people really understanding how they might be able to prevent disease so they wouldn't be in need. So I think it's amazing and wonderful that it's an entire month.
Absolutely. And as I mentioned when I was introducing you, both of you serve on boards that promote the message of organ and tissue donation. How have you been able to use your voices to make a difference in this area? Well, since we started with Dr. Norman first, we'll start with Denise this time.
Sure. So I'm relatively new to the Gift of Life board, but I've been familiar with MOTEP and the efforts and initiatives that they've had. And so I hope I use my voice by being a promoter of the importance of having people register So simple tasks that we can do to make sure that we are organ donors, and really just awareness of the needs that are sometimes, like I said, disproportionate for people of color. And you've got with that the voice of helping people to understand that it's safe. And that it is absolutely, I think, something that's important for people to consider for their loved ones when and if they're in a scenario where they can be donors. And in the African American community, sometimes that's a sticky subject. So I've tried to use my voice to encourage people to be a part of the process.
Dr. Norman?
Absolutely. So I'd like to echo all those things. I think that I try to, make this part of what I do every day. Whether it's with my family and friends, whether you find yourself at events, I think there's always an opportunity to talk about organ and tissue donation. There's always an opportunity, whether I'm, at the barber shop or at a store, if people bring up concerns or myths about donation or transplantation, to try to address those. And then I think to continue to partner with a number of organizations that are interested in this field to better move things forward and really meet the needs of the community.
Absolutely. And you mentioned barbershop, which reminds me, this has been the COVID era, and some of us need to get to one. But this really has been, that's obviously a lighthearted little thing, but more importantly, both of you have used the word disproportionate when talking about organ and tissue donation, and especially among African American communities or multicultural communities. Denise, you were appointed by Governor Whitmer to serve on the coronavirus task force on racial disparities. Can you please share with us some of the goals of this initiative?
Absolutely. So I think first and foremost, I want to say I stand with Governor Whitmer and the response that she had to the coronavirus pandemic globally, but specifically when we started to see that the outcomes for people of color, African Americans in particular, were disproportionate to their representation in the state. The task force was formed, and that was in early April. At that time, the focus was really on testing because, as you know, we had a shortage with testing supplies and we really didn't have good surveillance to understand who actually was infected with the virus. We kind of progressed from there to access. So once someone is tested, whether they were positive or not, wanting to make sure they had primary care provider relationships and just access sometimes to housing, to food, whatever support they needed. If in fact they were ill, being able to recover. And if they were not ill, just making sure that they were managing their chronic conditions. Most recently, you're probably both aware that the governor has declared that all health professionals in Michigan will have unconscious bias training. And so a lot of the other piece of the task force has been, we believe that unfortunately the disproportionality that we keep talking about has existed in our healthcare system for many years. And this is really exposing it, unfortunately, because we're at such a vulnerable point. So now we're focused on what kind of solutions can we put in place to maybe restabilize the environment and make sure that we have a healthier community coming out of this pandemic.
So I'm going to follow up on that. And you're right, Governor Whitmer declared that racism is a public health crisis.
Yeah.
So how can we integrate that message into the critical importance of the need for more minority organ and tissue donors?
I would hope that one way that we could connect it, there's been a lot of outreach for this campaign, right, in terms of educating people. And Dr. Norman began to talk about it with being in maybe non-traditional spaces, but with very relevant messaging. And so I think it is totally connected, right? Because in that public health crisis that we have around racism, who's offered, a transplant is something that we can educate and help people to consider. I actually have a personal friend who waited way late in the stage of his disease to even get on the transplant list because of misinformation. So I think one way we can connect is a lot of the social media and a lot of the press that is there around the inequities that are in care. They should expand to the issues and conditions that may cause transplantation and help to break down some of those myths and actually make it easier for people to be a part of the process.
But Dr. Norman, what do you think some of those myths are? Or what it's kind of like, what is the key message? But what do you have to have key messages? You need to know what you're addressing.
No, absolutely. And so I think that highlights, I think, a couple of steps where we have an opportunity for improvement. I believe that armed with the right information, people will do the right thing. And people will try to step up and meet the needs, of their communities. So I think the first thing is that there's a lack of recognition of the extent of disease, of the endemic amount of disease we have in a number of communities. And I think people are really unaware of that. Secondarily, I think people don't really know in practical terms a lot about prevention always, and what they can do in their daily lives to minimize their chances of either getting some of these diseases or them progressing to end organ disease. Similarly, I think there's a lack of understanding of really the need for organ donation. I think one of the challenges for those of us who do this day in and day out is to remember. Sometimes I like to go back and talk to my mother, who's both very smart but also doesn't do transplant all the time, to remember all the things that those of us in the field sometimes take for granted, in talking with the community. And so really educating people about the need for organ and tissue donation. And then as we move to that, educating people about both on the living donation side, about the safety, and then in terms of a number of issues, which I think we'll talk about in terms of deceased donation, what you can do as you pass away, everything from donor registration to how that affects your care near the end of your lifetime to, what that means for your funeral services. So I think there's a lot of opportunity to address some of these concerns that people have all along the way.
We're in this virtual moment, so to speak. I mean, this conversation we're having right now is probably not something that would have been happening a year ago through this online device. Is there a way to capitalize on that to engage our communities about health disparities and supporting donation?
Yeah, I definitely would say yes. I mean, we've got several subcommittees that are coming out of the governor's task force on racial disparities. And even though it's COVID-19 focused, realize we have broadened it, right, to be all of the opportunities we have. And one thing we're learning is that I think the data point is maybe like 95% of our citizens have cell phones. So the idea of what we can do with push messaging now, that we maybe get them now, right, from our optometrists. I always laugh. I'm like, the dentist and the optometrists do a good job of reminding us of our annual appointments. But we could, do messaging in that way, knowing that we've got this huge tool that we could capitalize on. Telemedicine is how we survived during the COVID period in terms of being able to communicate with patients for direct care. So I think absolutely this platform and technology and people not having to travel to get information is something that we should and could capitalize on.
Absolutely. No, I would just echo that. I think the rapid expansion of virtual platforms and virtual care has really given us an opportunity to educate people and reach people in ways we couldn't before. Certainly one of the things we recognize is that even if we're in the office having an interaction, we may discuss something, but it's not reasonable to ask somebody to remember the 10 minutes of stuff that I just said and then repeat that to their family. And so I think we have a great opportunity here to provide people information in a format that works for them, that they can digest at their pace, that they can ask questions. And I think we really have an opportunity to leverage both the technology and I think leverage the time we're in, where we have everything from the governor's office to the transplant societies engaged in this question of racial inequity and what can they do. I think we have a huge opportunity to leverage this for the better of our communities.
How would you or what suggestions do you have for increasing our engagement during these times? So like I said, as I said at the beginning, you've been part of the Let's Talk campaign. How do we make sure we don't lose momentum for that campaign?
So one of the things I would say is that those of us in it realize, this is work that goes on for decades. And we've got a huge number of very invested people, very good educators, very good community relations to reach out. We have a lot of partners in the community, which has been great to build these coalitions. And then I think after, perhaps, various things leave the news cycle, pre-COVID, when we were at the Secretary of State's offices, all the time, and that was the work that really improved substantially, donor registrations. And so I think some version of that work continuing to go to the churches and the synagogues and the mosque and the barbershops and the beauty shops and, meeting people where they are. I think all of us involved in this will essentially go anywhere that will have us to try to talk about these messages, because you never know where you're going to, meet that person, meet that next champion, for organ and tissue transplant. And it's hugely satisfying work and hugely needed work. So I think these platforms like Facebook, Instagram, I think just leveraging all we have in a continuous manner and with our partners to bring this message and help people do what I think at the end of the day, if they knew the need, people step up to meet the need.
Yeah. Denise, anything to add to that?
No, I think he summed it up well. Yeah, no.
Okay. Yeah, and of course I will put in a plug for signing up on the Michigan Organ Donor Registry. It takes about 30 seconds at golm.org or giftoflifemichigan.org. And Dr. Norman mentioned we have a great partnership with the Michigan Secretary of State, the Department of State. I just want to give some kudos to Secretary of State. They recently added a question to their renewal by mail form for driver's licenses, where people can check a box and that will put them on the donor registry. This has been a long time coming, and it's another great way, especially in an era where we're not going to be going into offices as much, where again, it's real easy, make it simple. But of course, as both of you said, we have to lay the groundwork first for people to be comfortable saying yes to donation. So it's as my colleague Ramona Chapman always reminds me, you meet people where they are. You ask them what you can do for them, not tell them what you want from them. So we know there's a lot of work. As you both said, this is years in the making. This is not something you snap your fingers and we've got the problem solved. So, and of course, you two are leaders in this. What would you say to other, either your fellow board members or others in the communities about being ambassadors for the Let's Talk campaign and for organ and tissue donation?
I mean, I think all the things that Dr. Norman said that are the possibilities, it really is just making it a part of who you are, quite honestly. So a part of regular conversation and regular dialogue in terms of encouraging people to do the things that they can do, right? Whatever that might be. So being registered and being engaged and understanding what signs and symptoms are even of disease, understanding prevention. So it's really encouraging people during the Let's Talk campaign to talk and be ambassadors and spokespersons. And I would hope that all of our fellow board members are doing that. But I do think we also have the opportunity really to expand it through our own social networks that we have. And I think if we do that, then we would raise awareness for a huge group of people that would then expand to another group.
I completely echo that. I think one of the interesting things for me has been, one, recognizing the importance of listening to people and to communities. And one of the things I find fascinating whenever we do any event is I think the questions you think will be the questions at the end of the event are completely different questions. People don't wonder necessarily things I thought. They have really other concerns and other practical questions that you only have an opportunity to answer those if you go to where people are and listen to their questions and concerns so you can address really what's on their mind.
All right. Well, I want to thank both of you for joining us this afternoon. Just want to open up any final thoughts or comments. We'll start with you.
Oh, I would definitely say thank you for doing this, because I think this is a part of that platform building that you're describing, giving people an opportunity to pause and think and reflect in short sound bites. So I would just say, everyone, please be a registered organ donor. And it's something that's important for you to spread throughout your family and your community.
I would echo that. I want to thank Gift of Life for hosting us. This is terrific. Exactly like Denise said, this is exactly the work that needs to be done. I would echo her sentiments of the importance of everyone being registered as an organ donor. That's so important to us. And then I would invite folks, both who are listening now or who have questions later, that I would certainly offline, if there's other questions or concerns, happy to try to address those, and we could figure out a way for folks to get in touch.
Yep, just keep that conversation going. And of course, as I think it's scrolling across the screen, you can always sign up to be an organ, eye, and tissue donor at golm.org/register. And you can also go to our website for additional information, as well as Detroit Motep Foundation site, and get your questions answered. We can't answer them unless you ask, and we're here to provide a service. And of course, Dr. Norman and Ms. Brooks Williams are great ambassadors, and I thank you both for your time, your talents, and willingness to share those with others. So thank you, and this concludes our Let's Talk Tuesday.
Thank you.
Thank you.